Hi there, this is Jenny Schwartz, and I am doing my disability pamphlet on traumatic brain injury and some things to know about TBI in children, especially, is that typically traumatic brain injuries tend to have a more severe effect on young children because their brain is still developing. Um, so the effects might only become more apparent as the child gets older. And so I believe traumatic brain injury is a little bit different than some of the other disabilities that we might be learning about. Um, the effects of a TBI might include impairment of thinking or memory, movement, sensation, and that could be vision and hearing, emotional functioning, some personality changes, things like that. Some of the danger signs in children is very similar to that of adults. Headaches that get worse and don't go away, weakness or numbness, vomiting or nausea, slurred speech, convulsions or seizures. They might have unusual behavior. For young children especially, they might not stop crying and might be inconsolable, and they might not nurse or eat. Some of the traumatic brain injury across developmental areas that we touch on is the social emotional. Oftentimes you might see inappropriate social behaviors or emotional responses that might not match up to the specific setting, difficulty regulating emotions. When we get into language and literacy, there might be some speech or language deficits. Being able to follow multi-step directions might be difficult. With cognitive, there might be difficulty with problem solving and some of those reasoning skills. They might be slower to respond, difficulty remembering tasks, and storing new information, kind of dealing with that memory. They might be a little bit disoriented with time and places, difficulty sequencing events. And we get into some of the physical, and they might struggle to process visual information. They might have some seizures that will continue, difficulty staying awake, possible gross or fine motor deficits, and with sensory issues. I think the biggest thing to keep in mind when we're thinking of TBI is that the brain is so, there's so many parts that we're still learning about that different injuries will affect different children and different people very differently. And so these are just kind of some of the things that they might, so for sensory, it might affect a child's vision, it might affect hearing, there might be some tactile issues to deal with, their sense of smell and taste may be affected. It really depends on what part of the brain was affected. Services provided for children with traumatic brain injuries, they may be eligible for special education related services if the injury adversely affects their education. And they're in the state of Minnesota, they also offer a brain injury waiver that you may qualify for and receive financial services to help cover some of the costs of providing care in a home or in a different setting. Medications, I'll just touch on a little bit because typically those are more so related to directly after the traumatic brain injury has occurred. There isn't really medication that you would take continuously. And again, educational and cultural implications. I was not able to find much at all about cultural implications. Again, TBI is kind of its own entity because typically the injury has happened either from abuse, from some sort of an assault or some sort of injury. and or accident. And so oftentimes this disability might be seen or viewed a little bit differently across different cultures, just because there isn't, it probably wasn't always there. So for educational, just to keep in mind, repeating instructions and directions, being patient with them, remembering that the student might take a little bit more time, make sure you're having consistent routines and rules. Usually using pictures and visual cues often helps to keep them on task. Explicitly teaching coping and de-escalation strategies, I think, is a great one. Engaging the student in role play scenarios. And I would say on the cultural aspect is just making sure that people are utilizing healthcare interpreters to make sure that information is being relayed correctly and any questions or concerns from the family are also being met. Some of the resources we have the Brain Injury Association of America, one of the books, Children with Traumatic Brain Injury, A Parent's Guide, and I also found a children's book that's called Get Well Soon Balloon that helps teach children, if you have either a parent or a child in the home that has a TBI, to kind of explain to the other members of the family. Hopefully from this video and from my pamphlet you will know a little bit more about traumatic brain injury in young children, and I look forward to learning more from you all as well. Have a great night. Thanks.